If someone has ingested poison, every second counts. Poisoning can be life-threatening, but with the right first aid, you can stabilize the victim until emergency help arrives. In this video, we'll guide you through the critical steps to take and what to avoid to save a life. Look for these signs of poisoning: nausea or vomiting, difficulty breathing, drowsiness or loss of consciousness, burns around the mouth if corrosive poison was ingested, and seizures or confusion. Call emergency services immediately. Dial 112, the EU emergency number, and provide details of the poison if known. Do not induce vomiting, as this can worsen damage from corrosive substances. If the poison is corrosive, have the person rinse with water but do not swallow. If unconscious, place in the recovery position to prevent choking. Monitor breathing and perform CPR if breathing stops. Never give water or milk unless advised by professionals, as some poisons react dangerously. Do not wait for symptoms to worsen. Act fast. Avoid home remedies like charcoal unless instructed. Medical teams may use antidotes, stomach pumping, or intravenous treatments. Bring the poison container to help identify the toxin. Prevent poisoning by keeping chemicals and medications locked away. Use child-proof containers. Never store toxins in food or drink bottles. Share this video, it could save a life. For more first aid guides, subscribe and enable notifications. Stay safe. Call 112 for the EU emergency number and follow local poison control centre advice.